The 5 most common knee injuries for seniors. Knee pain is common in people of all ages, but if you're over the age of 55, you know that those aches don't go away quite so quickly anymore. While a little discomfort can be expected, it's important to realize that your aging knees also leave you more susceptible to injuries. And that can put a big damper on your day-to-day activities. After all, knee injuries can be quite debilitating, interfering with simple activities like getting up from a chair or walking, let alone golfing or exercising. To make matters worse, the injuries not only take a long time to heal, but leave you more susceptible to injuring them again in the future. But this doesn't have to be the case. In this video, we'll talk about 5 of the most common knee injuries in seniors, while giving you some practical tips on how to avoid them. Let's get started. Don't forget to subscribe to our channel for unlimited tips and tricks to staying young and healthy. The anatomy of the knee. To understand common knee injuries, you first need to understand the knee itself. The knee is one of the largest and most complex joints in the human body. Of course, it also plays a vital role in movement. Without our knees, we'd never be able to do simple activities like walking, running, and jumping. But the knee is also something of a work of art. Looking at its components, you can see that the knee joint is formed by 3 bones: the femur, or thigh bone, the tibia, or shin bone, and the patella, or kneecap. The femur and tibia meet at the knee joint, with the patella sitting in front. Because the knees take such a beating throughout our lives, they require a lot of padding in the form of cartilage, which allows for smooth movement between the bones. Meanwhile, the menisci, 2 crescent-shaped pieces of cartilage, act as shock absorbers, cushioning the joint. Next, you have the ligaments, strong, fibrous tissues that connect bones and provide stability to the knee. The most important ligament in the knee is the anterior cruciate ligament, or ACL, but you also have the PCL, MCL, and LCL, all of which are subject to injury. Last but not least, you have the bursa. These are small, fluid-filled sacs that provide additional cushioning and help reduce friction on the bones, tendons, and muscles around the knee. Now that you have a better understanding of the various components of the knee, let's delve into the 5 most common knee injuries among seniors and how to prevent them. Number 1, patella fracture dislocation. When it comes to fractures or dislocations, the patella or kneecap is the most common bone to be injured. Regardless of age, patella fractures are quite common, often stemming from sports injuries, falls, car accidents, or conditions like osteoporosis. This is because, unlike other bones, the patella isn't attached to any of the bones around it. Instead, it floats on its own in synovial fluid, which is what allows a wide range of movement. But here's the thing. As we age, the amount of synovial fluid around the patella decreases, reducing the padding that protects the kneecap. Since the patella acts as a shield for the knee joint, it is highly susceptible to fractures when you fall or collide with an object. A fractured kneecap is a serious injury that requires the knee to be immobilized to allow the bone to heal. The older you are, the longer recovery will take. In some cases, surgery may be necessary. Ligament strains and tears. Ligament injuries are extremely common, especially for people who are active in sports. They most often occur when the knee is overextended or moved in an unnatural way, which causes the ligaments to stretch or tear. The most commonly injured ligaments are the ACL and PCL, followed by the MCL and LCL. Since all of these ligaments are responsible for stabilizing the knee, damaging them can lead to a wide range of results. In some cases, they will merely be overstretched, causing swelling and pain. A partial tear, meanwhile, means more pain and reduced movement of the joint. In the event of a complete tear, the joint may become unstable, requiring surgery. Though common in football players, older adults can suffer ACL tears simply from falling or stumbling. Meniscus tear. A meniscus tear typically occurs from a twisting motion, which can happen during sports or even from simple activities like getting up from a chair in older adults. Doctors often say that meniscus tears have ended a number of retirees' golf careers, as the twisting motion is typically associated with a golf swing. There are several types of meniscus tears, with incomplete tears being the most common. While some meniscus tears may heal on their own, this process becomes slower with age. More severe tears may require surgery and long healing times. Knee tendon tears. The knee is full of tendons, as these are what help facilitate the bending and straightening of the joint. While anyone can suffer tendon tears, they are much more prevalent in middle-aged or older individuals due to the way our tendons lose elasticity with age. Tendon tears can result from sudden trauma, such as a fall or awkward landing, or from chronic wear and tear on the knee joint. Underlying conditions like gout, hyperparathyroidism, rheumatoid arthritis, and diabetes can also make tears more likely. Symptoms of a tendon tear include pain, swelling, instability, decreased range of motion, and sometimes a snap or pop at the affected area. Osteoarthritis. While not an injury per se, osteoarthritis is one of the most common knee-related conditions seen in older adults. This term refers to a condition in which the cartilage in the knee wears down over time, causing stiffness, reduced mobility, and pain. In some cases, bone spurs can form, further increasing discomfort. The biggest issue with OA is that it is often progressive, which means it can worsen with changes in weather or increased physical activity. If you ever had an older family member who could predict thunderstorms based on their knees, they likely had osteoarthritis. Preventing common knee injuries. As common as these injuries are, it's important to remember that they are by no means inevitable. There are things you can do right now to prevent knee injuries, regardless of your age. You should start by engaging in regular physical activity. This helps strengthen the muscles that support your knees and improves joint flexibility. For older adults, the best options are low-impact exercises like walking, swimming, or cycling. Maintaining a healthy weight is also essential. This is because carrying too much excess weight can put additional stress on your knees, increasing the risk of injury and conditions like osteoarthritis. You should also take steps to protect your knees by avoiding high-impact activities or wearing proper footwear and a knee brace during activities that strain the knee. Speaking of which, investing in good shoes and orthotic inserts can also help cushion your feet and promote good posture, which can prevent knee injuries. If you do injure your knee, the RICE method, rest, ice, compression, elevation, can help reduce swelling and promote healing. Make sure to avoid activity until you're feeling 100%, as you'll be susceptible to re-injury until then. Finally, make sure to eat a diet rich in fruits, vegetables, and lean proteins to support joint health and reduce inflammation. You can also take supplements like calcium and vitamin D to support the health of all your joints, knees included. Unfortunately, knee injuries are all too common, especially for people who were active in their youth. Whether you played sports or suffered a fall, your knees have likely taken a beating over the years. The good news is that with the right care and prevention strategies, you can reduce your risk of knee injuries and maintain your mobility well into your senior years. Please don't forget to click the like button and subscribe to our channel if you enjoyed this video. We are constantly putting out fun videos on everything related to wellness. Please remember, this video is meant for educational purposes and is not medical advice.